I was born in Redding on Placer Street at Miss Anderson's maternity home, and raised in Central Valley, which is now called Shasta Lake City.
Dignity Health Connected Living provides a variety of services, including our nutrition programs and food bank, transportation services, management services to help seniors stay in their homes. We have an adult daycare program, senior volunteer programs, and representative payee programs and advocacy for seniors.
When I got married, I moved over past Summit City and been there 50 some odd years now, probably 55, 56 years on Irish Road.
The challenges, I think, are some of the space that we deal with, being in a rural area. We're dealing with people that are not next door. Sometimes they might be, miles away is the closest neighbor in some of our more rural areas. And there's a lot of folks that live in that situation. And that's difficult. It's difficult for neighbors to know about other neighbors' needs and to check in on them easily if they haven't already established relationships with those people. Charlene's situation, she's not right in the center of town, and so she has experienced times where she has needed people to look in on her more easily, and it's not been something that has been able to happen quickly. And sometimes those can be life and death situations if you don't have access to people around you.
I spent 4 days and nights on the floor, and I thought, boy, what a way to go, I couldn't get to water, I couldn't get up, I couldn't get a blanket to cover up with, I was freezing. Finally, my neighbor guy, he came over and hung some of my mail on the outside of my door and rang the doorbell, and I hollered help, and he didn't respond. And so he went home and told his wife, he says, I don't know if I'm hearing Charlene hollering for help or not, says, with my hearing so bad. And she says, well, if you think she is, says, you call the authorities. So he went ahead and called the authorities. So I learned to put my emergency necklace thing to where I could reach it when I needed it, because I couldn't get to them.
I have a lot of problems with myself. I went through a lot of depression. And thank God to them, every time I feel very down, I used to call Debbie or Joyce. And then I was a lot of times in the hospital, and they come over and visit me and talk to me. So really comfort to me that I know that in case how big it is, that I can count on somebody else in case I am down.
The Primary Care Plus program is a really great program that was started in 2017. It really focuses on our population of elderly Medicare patients who have complex medical needs.
When a patient gets admitted to this program, we start with who they are, if they live alone, what they want in life. So when COVID hit last year, Debbie and I talked, remember, these are the patients that live alone with no family support. So we reach out to those patients first.
Well, I think that these two ladies, they are great ladies. They have been helped me a lot. They call me to see how you're doing, if I need anything, and always they are here for me.
I'm most proud of the fact that we really helped reach out to our vulnerable population.
This is the most rewarding of all. I think we're helping the most vulnerable population in Kaiser Permanente.
You had to fight for it and keep going, because life is so short, might as well enjoy it. And you can say thank you very much.